Malasakit or marketing, a closer look at the political machinery behind Bong Go's rise. In the recently concluded 2025 midterm elections, Christopher Lawrence Bong Go stunned analysts by securing the top spot in the Senate race with over 20 million votes, 7 million more than his closest rival, Bong. The result, while numerically impressive, raises deeper questions about the intersection of public service delivery and political branding in the Philippines. Is the Malasakit Center, a flagship project championed by Bong Go, institutionalized through Republic Act No. 11,463. The initiative was touted as a one-stop shop for government medical assistance, aiming to streamline access to services from the Department of Health, DOH, Department of Social Welfare and Development, DSWD, Philippine Charity Sweepstakes Office, PCSO, and PhilHealth. But was it really a groundbreaking reform, or just bureaucratic repackaging with political undertones? Old system, new paint. Before the Malasakit Center became law, most government hospitals already had functioning medical social services offices, MSSOs. These offices coordinated with the same agencies to provide financial assistance to indigent patients. It was a system that, while not perfect, was integrated into the hospital's workflow and understood by those who relied on it. What the Malasakit Center did was consolidate agency desks into one location and brand it as something new. However, patients have reported that paperwork is still redundant and queues remain long. Instead of streamlining the process, the centralization may have only increased the volume of applicants per location, leading to longer wait times and overburdened staff. Ironically, instead of reducing bureaucracy, the Malasakit Center added a new legal and administrative layer with its own center manager and staff, requiring additional funds from the DOH's budget. No new assistance funds were created. The same agencies simply reallocated their desks under a new banner. Malasakit as political capital. The rollout of Malasakit Centers became a national campaign tour in all but name. Bong Go's face and name were plastered across hospital walls, banners, and public spaces, blurring the line between government service and personal political promotion. It is no coincidence that this initiative gained traction in the months leading to the 2019 elections. For many observers, it was a case study in how state resources and public institutions can be instrumentalized to build political capital. Go, long known as the close aide of then-President Rodrigo Duterte, positioned himself not just as a successor to Duterte's image, but as a benevolent patron of the poor. In short, Malasakit became a brand, not a reform. And in politics, brand recognition can translate into votes. The illusion of care. The word Malasakit evokes empathy and concern. But for many patients, what they've encountered is the same old government routine, just now under a different signboard. Despite the lofty promise, no independent audit or comprehensive evaluation has been made public to prove that the Malasakit Center has significantly improved service delivery. Meanwhile, frontline health workers, already stretched thin, have had to absorb the added administrative workload. Hospital systems had to make room for this new layer of bureaucracy, often without the flexibility or support to integrate it smoothly. If anything, the burden has shifted from the patients to the staff, not eliminated entirely. A systemic problem, not a slogan solution. The Malasakit Center may have helped some patients, particularly those unfamiliar with how to navigate government red tape. But that marginal benefit cannot justify the way it was used to mask deeper systemic inefficiencies and promote a single politician. Genuine public service should be institutional, accountable, and apolitical, not performative. In the end, Bong Go's Senate victory was not just a result of popularity or charisma. It was an outcome engineered through the creative rebranding of public services, where access to healthcare assistance was intertwined with electoral propaganda. That he garnered millions of votes more than a sitting senator known for legislative reforms speaks volumes about how perception often outweighs policy in Philippine politics. The Malasakit Center may have won votes, but it has yet to prove that it can win real, measurable improvements in public health access without the shadow of political self-interest.